COVID-19 has had a global impact on all of us, but those most affected are women and girls, particularly those most marginalized in society. Among the women and girls, you have the women and girls living with disability that are even more vulnerable. Their vulnerability comes from discrimination, environmental, policy, and institutional barriers created by individuals and perpetuated across all levels of society.
Women and girls with disabilities had, as much as possible, they had to stay at home, and they had to stay at home all by themselves because people also were worried. Remember that COVID-19 was quite a menace to everyone. And if people knew that for me to be safer, I should maintain the distance, then they wanted to maintain the distance. And they distanced themselves from people who needed them, who needed their support.
Les femmes alors vont en souffrir beaucoup parce que elles vont se retrouver en cas de faiblesse sans capacité de se prendre en charge. Il y a des personnes qui profitent de ça pour les abuser et les exploiter. Et beaucoup de femmes handicapées, des filles handicapées sont victimes de violences causées par cette négligence, cette non-intégration, cette non-inclusion des personnes handicapées dans leur société.
People with disability are not often at the decision-making tables. In this pandemic, women and girls with disability have been absent in COVID-19 response and recovery policies, plans, protection and prevention measures. UN Women's regional analysis on trends related to women with disabilities during the pandemic aimed to better understand the realities for women and girls with disabilities and promising practices for their inclusion. It highlighted the importance for their representation across responses and in ensuring inclusive access to information, social protection, livelihoods, opportunities, and public protection measures.
One of the key barriers to effective service delivery for women and girls with disabilities is limited data. Data is important in informing and guiding UN entities, national governments, civil society organizations, and private sector on policy making and enforcement, programming and service delivery to ensure investments are reaching those who need it most. Policies recognizing disability inclusion have been formulated at both national and international level. However, the policy implementation and enforcement processes are slow, hence not much impact has been achieved.
I think each time there is an emergency, let's think of women and girls with disabilities, and let's have resources mobilized so that they can also be included. They can be trained, they can be equipped with appropriate gadgets so that they can participate on equal terms with everybody else.
Economic empowerment of women with disabilities need to be part of policy design by governments in response to COVID-19 to support women to generate self-reliant activities and reduce dependencies and create opportunities.
Faire de plus, c'est intervenir et investir dans le domaine du handicap. Ça serait plus utile pour les personnes handicapées en général et les femmes handicapées en particulier.
Now that we heard from various sources on practices and situations of women with disabilities during the COVID-19 time, it is our turn to act. We need to act to improve representation in decision making. We need to act to also improve the inclusivity of the platforms where we address issues of response to COVID-19. To achieve our shared objectives to break the cycle of violence against women and girls, we must first secure the spaces and platforms to hear from and let women and girls with disabilities lead, and will ensure our future efforts lead to a more inclusive and equitable society.